Parkinson's disease is a neurodegenerative condition which affects movement, thinking, and sometimes emotional processing as well. The substantia nigra is a small part of the brain that is responsible for synthesizing a neurochemical called dopamine. And dopamine is a neurochemical that stimulates movement and is also involved in many emotional states and in our feelings of pleasure and reward. Parkinson's disease occurs when the substantia nigra degenerates. What that means is that the cells in the substantia nigra begin to die prematurely. And when the substantia nigra begins to degenerate, it no longer produces enough dopamine to stimulate other areas of the brain that coordinate and execute movement. The most common symptom of Parkinson's disease, the symptom that people most associate with the disease, is tremor, or involuntary shaking. Sometimes on one side of the body, sometimes on both sides of the body. The tremors can occur in the hands, in the head or neck, and sometimes in legs as well. We don't know exactly what causes Parkinson's disease. Like a lot of diseases, it's probably caused by a combination of genetics and environment. There are some genes that have been shown to increase people's risk of developing Parkinson's disease, but those genes in and of themselves aren't enough to cause the disease in everyone who has them. We've identified some factors that seem to increase risk in some people, including repetitive head injury, as we see in boxing and other contact sports. Exposure to certain pesticides and solvents might also increase people's risk. Early diagnosis is very important because Parkinson's is a progressive condition. The symptoms get worse over time, and so the sooner we diagnose the condition, the sooner we can begin to treat the symptoms. We can also start physical and occupational therapies, psychotherapies to help with adjustment emotionally to the disability sooner rather than later so that people can begin to go back to their lives and function better.